As a heart surgeon with decades of experience, I've seen thousands of seniors sit across from me, concerned about sudden chest discomfort, unexpected breathlessness, or waves of fatigue that seem to strike out of nowhere. Most assume it's simply aging, stress, or maybe carrying a little extra weight. But in many cases, the real danger hides somewhere far more unexpected, in the very medications they've trusted and taken for years, sometimes prescribed for entirely different problems. What many people over 60 don't realize is that some common pills, taken daily by millions, can quietly weaken the heart muscle, raise blood pressure, or disturb the heart's rhythm, often long before any obvious symptoms appear. These side effects don't strike overnight. They build silently, like waves wearing down the shoreline, stressing your heart day after day while you feel perfectly fine, until suddenly, you don't. And sadly, many seniors only discover these dangers after serious damage has already been done. That's exactly why this video may be one of the most important you'll watch, because you still have time to protect your heart before it's too late. I created this not to scare you, but to give you life-saving knowledge. And somewhere in the middle of this video, I'll share one surprising insight that even many doctors overlook, something you truly don't want to miss. If you find this helpful, please consider subscribing to our channel, Over 60 Wellness, and give this video a quick like. It truly helps us create more life-saving content for wonderful seniors just like you. Now, let's begin, as I reveal the 7 most dangerous pills silently threatening the hearts of millions, starting with one that may already be sitting quietly inside your own medicine cabinet. Pill number 7. The pain relievers that pretend to be friendly, NSAIDs. Every morning, many seniors walk to their medicine cabinets, open the door with routine comfort, and reach for tiny bottles of ibuprofen or naproxen without hesitation, because those pills feel like trusted friends who've been helping for years. Your stiff joints, aching back, or sore knees seem to beg for that simple fix, offering you what feels like relief wrapped inside a small white tablet. But beneath that comfort lies something far more dangerous that quietly grows, slowly, invisibly, until one day it may come knocking loudly at your heart's door. You see, your heart works like an aging water pump, strong in its younger days, but with time, that pump naturally tires, its parts no longer as efficient as they once were. NSAIDs force your body to retain sodium and fluids, and that extra fluid creates a heavier load, pushing your heart harder with every beat, every breath, every moment, even as you sit peacefully watching television. Imagine an old car engine, one you've driven for years, being asked to pump thicker oil each day, the strain growing gradually, unnoticed, until one day, something gives out. These medications don't just increase your fluid load. They also tighten your blood vessels, causing your blood pressure to climb higher, often without you feeling any different at first. That's why so many seniors say, "But I feel fine, doctor," never realizing the damage quietly stacking up behind the scenes, drip by drip. Over the months and years, this silent stress weakens the heart's muscle fibers, which can eventually lead to congestive heart failure, shortness of breath, swelling, and fatigue that sneak in quietly and deceptively. And even those symptoms are often dismissed as just getting older, when in truth, they may be your heart's desperate cry for help before it reaches a crisis point. But the danger doesn't stop there. NSAIDs also put strain on your kidneys, those tiny filters that work hard to balance fluids in your body every hour. Once your kidneys weaken, fluid backs up even more, adding to the already heavy burden placed on your heart, and setting off a dangerous cycle that spirals downward without clear early warning signs. I've personally seen seniors, wonderful people in their 60s and 70s, who relied on NSAIDs for years, only to find themselves suddenly hospitalized, their hearts overwhelmed by fluid buildup they never even realized was happening. The tricky part with these medications is their seductive short-term benefit. They work. The pain goes away. You feel better for the moment. And that's what makes them so quietly dangerous over time. Pain relief is important, yes, but not at the expense of your long-term heart health. Not when safer alternatives exist that protect both your joints and your heart. Topical creams, like certain anti-inflammatory gels, avoid your bloodstream completely, sparing your organs from unnecessary burden. Physical therapy strengthens your muscles naturally, while gentle water aerobics and flexibility exercises help restore motion without adding any chemical strain. Even hot and cold therapy, acupuncture, and guided stretching routines can offer powerful relief for chronic joint pain, especially when combined with professional support tailored to your individual body. Of course, you should never make changes without speaking to your doctor first. But having these conversations early could save your heart years of silent strain you never knew was there. And as we move forward, get ready, because the next pill we're about to reveal may shock you even more, especially if you or a loved one is managing blood sugar every day. Pill number 6. The diabetes drug that quietly strains your heart. Millions of seniors across America battle type 2 diabetes every single day. They watch their blood sugar, change their diet, and take prescribed medications hoping to stay ahead of this silent disease. But not every medication that lowers sugar is kind to the heart, especially once you cross the age of 60. Some diabetes drugs, particularly in the thiazolidinedione family like pioglitazone, offer excellent blood sugar control, but they carry an invisible price that many never see coming until it's too late. Let's imagine your bloodstream as a long garden hose, pumping fluid evenly throughout your body. But these medications make your body retain more fluid than it should, slowly overloading that hose, adding more and more water into an already aging system. The extra volume forces your heart to pump harder every single moment, placing tremendous hidden strain on muscles that may already be weakened by decades of work. And while your sugar numbers may look fantastic on paper, quietly, silently, your heart could be inching closer to failure without giving you any clear warning at first. That's what makes these pills so dangerous for seniors. They mask symptoms, while pushing your cardiovascular system further toward its breaking point. Many seniors live with high blood pressure, past heart attacks, or slight heart weakness already. And adding fluid-retaining medications on top of that is like stacking bricks on an already wobbling wall. It may hold for a while, but eventually, something cracks. One gentleman in his late 60s thought his tiredness and swollen ankles were simply part of aging, but when his breathing worsened, doctors discovered significant fluid overload quietly building for months, with his heart struggling under pressure that his diabetes medication had unknowingly fueled. This isn't fear-mongering, my friend. This is awareness. The wonderful news is that modern medicine has evolved. We now have newer diabetes treatments that not only control blood sugar, but actually support heart health at the same time. Medications like GLP-1 receptor agonists or SGLT2 inhibitors have opened doors for seniors that didn't exist years ago, offering both sugar stability and cardiovascular protection. That's why you must always sit down with your doctor regularly, review your prescriptions together, and ask whether your medications are still the safest choices for where you are today, because your body at 65 is very different than your body at 45. And as we move forward, get ready, because the next pill may surprise even more seniors. It's one millions take every single night just to fall asleep, but maybe putting their hearts quietly at risk while they rest. Pill number 5. The sleeping pills that silence more than sleep. Every night, millions of seniors stare at their ceilings, tossing and turning, struggling to find the restful sleep their bodies crave. And for many, the temptation to reach for a sleeping pill becomes almost impossible to resist. Medications like zolpidem or diazepam promise peaceful nights, whispering relief into weary minds. But behind that temporary calm, a slow, dangerous erosion may be taking place inside the aging heart. You see, sleeping pills work by slowing down your brain activity, but they don't stop there. They also suppress your nervous system, your breathing, and yes, even your heart's natural rhythm as you sleep. In younger bodies, this may not be a serious issue, but for seniors, whose hearts are already balancing decades of wear, that extra slowing can quietly push them closer to dangerous rhythms they may never feel until it's too late. One of the most overlooked risks is how these medications worsen or even trigger sleep apnea, a condition where your breathing repeatedly pauses at night, starving your heart of precious oxygen and forcing it to work harder each time your body gasps for air. And these repetitive oxygen drops don't just disturb your sleep. They hammer your heart, spiking blood pressure and placing silent strain that accumulates night after night, year after year. I once saw a woman who had taken sleeping pills nightly after losing her spouse. She felt rested at first, but months later developed unexplained fatigue, dizziness, and multiple falls. Her heart and brain were quietly being drained without her even realizing it. What's even more concerning is how these pills interact with other medications commonly prescribed to seniors. Many take beta blockers, blood pressure meds, or arrhythmia drugs, and when you add sedatives into the mix, it's like layering weight on an already fragile bridge. The result? Higher risks of sudden drops in blood pressure, confusion, irregular heartbeats, and even dangerous falls that can lead to fractures or long hospital stays. But the truth is, better, safer solutions exist for seniors who struggle with sleep. Simple changes like creating a consistent bedtime routine, limiting caffeine and screen time late in the day, engaging in light exercise, or practicing guided relaxation techniques can dramatically improve sleep without compromising your heart's health. In some cases, short-term natural supplements like melatonin, under medical supervision, may also help regulate your sleep cycle safely. And always speak to your healthcare provider before starting or continuing any long-term sleeping medications, because your body's needs change with age, and what once worked safely may no longer be your best option today. And as we continue, brace yourself, because the next pill might shock you even more. It's one that millions take daily for mood or pain, yet few realize how quietly it can destabilize their heart's natural rhythm. Pill number 4. The antidepressants that mess with your heart's beat. As we grow older, emotional challenges often become part of daily life. Many seniors deal with grief, loneliness, anxiety, or chronic pain that weigh heavily on their hearts and minds. And sometimes doctors prescribe antidepressants to help ease that emotional burden. But not all antidepressants are created equal, and some older types, known as tricyclic antidepressants like amitriptyline or nortriptyline, carry hidden risks for seniors that quietly target the heart's natural rhythm. You see, your heart beats because of tiny electrical signals, like a well-tuned orchestra following its conductor, but tricyclic antidepressants can interfere with those signals, causing irregular heartbeats, dangerously slow rhythms, or even a complete heart block in vulnerable seniors. That's like the conductor suddenly losing control of the orchestra, leading to chaotic, unstable rhythms that can cause dizziness, fainting, or in severe cases, life-threatening arrhythmias. These drugs also lower blood pressure when standing up, which increases the risk of falls, a serious concern for seniors whose bones and balance are already more fragile with age. I recall one gentleman who fainted simply while standing to grab his newspaper. His dangerously low pulse was traced back to an old prescription quietly disrupting his heart's electrical pathways. What makes it even more concerning is that many seniors take these medications not just for depression, but also for chronic nerve pain, migraines, or insomnia, without realizing how their aging hearts may no longer tolerate these older drugs safely. Fortunately, modern medicine offers better, Safer alternatives for seniors today. Newer antidepressants, such as SSRIs, are much gentler on your heart and still help balance mood, without causing dangerous disruptions in heart rhythm. But never stop or change any medication on your own. Always consult with your doctor, review your medications regularly, and ask if newer, safer options may fit your current health needs better, because what once worked at 50 may not serve you as well at 70 or 80. And before we continue, if you found this information helpful so far, please consider subscribing to Over 60 Wellness and leave a comment below. It helps us create more life-saving content for seniors just like you. And as we move forward, stay with me, because the next pill may catch even more seniors by surprise. It's hiding in plain sight inside everyday cold and allergy medicines that millions grab from store shelves without a second thought. Pill number 3. The decongestants that secretly raise your heart pressure. When seasonal allergies hit, or a head cold clogs your sinuses, many seniors head straight to the pharmacy shelves, reaching for decongestants that promise fast relief. But behind that easy breathing lies a hidden danger that your aging heart may not handle well. Medications containing pseudoephedrine or phenylephrine work by shrinking swollen blood vessels in your nasal passages, which opens your airways and makes you feel better quickly. But what many don't realize is that these drugs don't just target your nose. They tighten blood vessels throughout your entire body, including those feeding your heart. This narrowing raises your blood pressure and forces your heart to pump harder, even while you sit still, quietly placing your cardiovascular system under extra strain it may not be able to carry. Seniors who already battle high blood pressure or have a history of heart disease may find that even short-term use of decongestants can push their hearts dangerously close to trouble, sometimes triggering irregular heartbeats, palpitations, jitteriness, or lightheadedness that feels unsettling but gets dismissed as harmless. I recall one man who took over-the-counter decongestants for years every winter, only to find himself in the emergency room one night with rapid palpitations that wouldn't stop. His heart was screaming for help under the pressure of those seemingly innocent cold pills. The tricky part is that these medications are sold without prescriptions, leading many to believe they're completely safe. But as we age, our bodies process medications differently, and what felt harmless at 40 can quietly turn risky at 70 or 80. Always read labels carefully, and before taking any cold or allergy medication, talk to your doctor or pharmacist about safer alternatives, because sometimes the quick fix comes with a hidden price your heart cannot afford. And stay with me, because next we'll uncover a common pill for acid reflux that millions take daily, without knowing it may be silently weakening their hearts from within. Pill number 2. The acid reflux pills that drain your heart's strength. Acid reflux and heartburn are uncomfortable companions for many seniors, and medications called proton pump inhibitors, or PPIs, like omeprazole or pantoprazole, often feel like lifesavers, allowing millions to eat comfortably again. But when these pills are used long-term, they quietly start robbing your heart of critical support. These drugs work by blocking acid production in your stomach, which soothes heartburn. But stomach acid serves an important purpose beyond digestion. It helps your body absorb key nutrients, like magnesium, that your heart desperately needs to maintain a steady rhythm. When stomach acid stays suppressed for months or years, magnesium levels can drop dangerously low, leading to irregular heartbeats, fatigue, muscle weakness, and eventually, serious rhythm disturbances that put seniors at high risk of complications. I've seen patients who felt exhausted for months, their energy fading slowly, not knowing their long-term acid reflux medication was quietly depleting the minerals their hearts needed to function properly. Even more concerning, PPIs also disrupt your gut's healthy bacteria balance, fueling inflammation that's been directly linked to higher heart disease risk, turning what started as simple heartburn relief into a long-term cardiovascular threat. Short-term use of PPIs can be very helpful when needed, but long-term daily use, especially without regular monitoring, allows these risks to stack up silently behind the scenes. That's why you should always work with your doctor to find the root cause of your reflux, whether it's weight management, dietary adjustments, posture, or other factors, because masking symptoms long-term with medication may buy comfort today, but create new dangers tomorrow. And as we move forward, prepare yourself, because the final pill on our list is perhaps the most silently dangerous of them all, prescribed daily for millions of seniors, yet capable of weakening your heart without you ever feeling a thing. Pill number 1. The heart pills that can slow you to a dangerous pace. Calcium channel blockers are commonly prescribed to seniors for high blood pressure, chest pain, or arrhythmias. And while these medications can be life-saving for many, certain types, especially older ones like verapamil or diltiazem, can quietly tip aging hearts into dangerous territory. These drugs work by relaxing blood vessels and slowing your heart's pumping action, which helps control blood pressure. But in seniors whose hearts may already be slightly weakened, slowing things too much can create bradycardia, dangerously slow heart rates that leave you dizzy, lightheaded, or even fainting without warning. I've seen seniors who passed out unexpectedly while gardening or simply standing up, their hearts dropping into the 30s or 40s in beats per minute, silently pushed there by well-meaning medications that went unmonitored for years. What makes these drugs even more challenging is that their side effects often mimic normal aging: fatigue, swelling in the legs, shortness of breath, leading many to overlook the real cause until serious complications emerge. In some cases, calcium channel blockers can also interfere with other common medications seniors take, like beta blockers or certain diuretics, increasing the risk of dangerous drug interactions that compound the heart's burden quietly. But let me be clear, these medications still play an important role for many patients. When monitored carefully, under regular supervision, they remain valuable tools, but they demand extra vigilance as we age. Always review your medications with your doctor at least once a year. Ask whether your current regimen is still the safest, because what worked well at 55 may need adjustments at 75. And now, as we wrap up this vital discussion, let's take a moment to review what we've learned and the simple steps you can take to protect your heart's health moving forward. Final takeaway: protecting your heart with knowledge and action. Now that we've walked together through these silent dangers, I hope one truth stands clear. As we grow older, the very medications meant to help us can, at times, quietly hurt us, not because they are bad in themselves, but because our aging bodies change, and what worked safely in our 40s may become risky in our 60s, 70s, or beyond. You see, my friend, knowledge truly is your strongest shield. Understanding how medications like NSAIDs, diabetes drugs, sleeping pills, antidepressants, decongestants, reflux medications, and heart pills silently strain your aging heart gives you the power to act early, not in fear, but with confidence. The biggest lesson here is this: always review your full medication list with your doctor at least once a year, because even long-term prescriptions deserve fresh conversations as your body changes. Don't assume fatigue, swelling, dizziness, or shortness of breath is just getting older, because often your body whispers before it screams, and hearing those whispers early can save your heart, your energy, and your precious years ahead. Simple steps can make a world of difference. Stay active in ways that honor your body's limits. Eat heart-healthy meals rich in nutrients. Prioritize restful sleep naturally whenever possible. Stay curious about how your medications interact, and most importantly, never hesitate to ask your healthcare team the hard questions, because you and the life you still have ahead are far too important to leave on autopilot. And my friend, if you found today's video helpful, If even one part of this message made you stop and think, please consider subscribing to our channel, Over 60 Wellness, where we're building a safe, honest place for seniors like you to stay informed, empowered, and supported. And if you know someone, a spouse, a parent, a friend, who may be taking these medications right now, quietly unaware of these risks, please share this video with them, because this simple act may truly protect a heart before it's too late. And if you'd like to support our work, please give this video a thumbs up, leave a comment below, and share it with others who may benefit. Your support helps us create even more life-saving content for wonderful seniors just like you. Thank you for spending your valuable time here. Stay strong, stay informed, and as always, take good care of your precious heart.